I'm taking away that gastroenterologists should definitely be worried about you, the stool DNA tests, the liquid biopsy tests, and so on, shouldn't they?
We really think that our test is actually going to add a lot of synergies to colonoscopy and will add a lot of value to, the focus is really that there are that there's a good percentage of patients that are eligible for colorectal screening that aren't getting screened. That's number one. So there's about, the compliance rate is about 60%, right? And then there's a lot of patients who would benefit from screening that aren't getting screened. So introducing another non-invasive option onto the market that would allow patients an additional option, another opportunity to get a non-invasive stool or a non-invasive screening test. And those patients, those 40% or so, would not have gone for a colonoscopy anyway. It's just we're targeting those patients, bringing them into the pool of patients that are going to get screened. That's number one. Number two, because of, as I mentioned, our test's ability to detect advanced adenomas with a higher sensitivity, we have looked into modeling studies in health cost effectiveness, health economic models. We see that our test would actually increase the number of colonoscopies being. We're going to increase the number of colonoscopies with a positive finding. So bring the patients in that aren't getting screened today into the pool, but also the patients that would require a colonoscopy because they have some sort of positive finding will be the ones that are going through for a colonoscopy. The third value is really because of that, where it becomes a more targeted approach to some degree, where because of the COVID-19 and the backlog and the issues with getting patients adequately in for a colonoscopy in time, you have a population of patients very well behind, and you can't screen everyone or bring everyone back at the right time. A test like ours that would allow for more, I wouldn't say selective, but at least making sure that the patients that are being offered a colonoscopy are the ones that are in need of a colonoscopy because of an abnormal finding. Again, it adds value to the GI's practice. So we think actually, we're here for the GI, we're here for the patient, we're here for the provider, the primary care. It's not a test that's going to take away from anyone. It actually will add value to all the healthcare stakeholders from what we see, right? And this is how we're trying to position it.